Network is an organization that looks at the issue that's affecting women, especially women living with HIV in Namibia.
2 years ago, I've been sick, and because of stigma, I almost died. You know, people are always like, they don't accept you. They don't want you in the family. They swear, they throw bad words to you. So I was now a bit worried. How now? How am I going to tell them? Because at the hospital they told me to bring the supporter. So I couldn't tell my family, and I waited for almost a year. Yeah, just hiding without treatment. And I'm very thankful to a support group. When I called them, they said, just come at our office tomorrow. They directed me there, and when I came there, they were so friendly, kind. They signed for me, and I started my treatment. So it was very good for me to join that support group.
I have been a member ever since its inception. That was 2008. And the reason why I decided to be a member is because I am a woman who is living with HIV, and to stand together with women when the issues arise so that we can speak as one voice.
Currently, Namibia Women's Health Network has a membership of more than 2,300 women all over Namibia. Before we enter an area, we assess the needs of the communities, the challenges they are facing, and we did the same for Dodabis, where we are right now.
Dodabis, 90 kilometers outside Windhoek, and we are a small constituency. I'm a community councillor working with them in the clinic. I'm community activist.
We've made sure that we've put our focal persons there so that whatever problems and challenges that women living with HIV and AIDS are facing relay directly to us so that we take action.
As you see, we have a lot of women, men in this group, elderlies, who is also affected. They are not infected but affected. So these problems are in our houses. That's why you see men, women, elderlies, and even church leaders assisting each other with information, first-hand information. And secondly, if there's someone who didn't come out, they like to talk to that person. You know, I was also in that situation. Look at me today.
If I'm sick, I must not thinking I'm sick. You must looking happy. Don't show at your face you are sick, you are helpless. No, I get it and I accept it, and that's why anybody can get it.
We have some rape cases in Dordrecht. We have women and child abuse cases and poverty because there's no job. And for this group, especially if you are on medication, you have to eat and drink. There's a lot of men who came for testing just because these are the example. And these men can also stand up for their wives and said, you must go for testing because I am infected.
So next time when you come to Windhoek, I think we're going to have a capacity building, Edwina.
Okay.
And I think we're going to be needing 2 people. I'm not sure, I'll confirm.
You know, I feel so powered today to stand up because those days people were so afraid to open up. But then now today they are so open. We came together, I started this group, we came together, we talk about things which is really happening in our community.
We women in our location, we are suffering too much. Lack of education. Women staying together with boyfriends and getting children, unprotected sex, and they even get unwanted pregnancies, and now they are just carrying while the baby, the other one on the back, pregnant, another one there, because they don't know what to do. So we need more education here.
Yes, network have achieved a lot in terms of advocacy. We have been advocating for the right of possible women who have been sterilized without their consent. And as we speak now, we have won the case. The case was sent back to the higher court to determine the compensation for the women who have been sterilized without their consent.
They take my womb. I can't bear any more children.
You're telling me you can't bear any more children?
Yeah. The doctor told me so.
And this sterilization thing, what is that?
It means maybe we need a professional medical so that can they explain
I
well.
cannot have a woman who doesn't bear children.
We learn even how to not to sign any papers from hospitals for operation, like, you know, we women sometimes we do just sign because we are told to sign, but you don't know what you are signing.
We are part of all the committee that dealing with health issues in Namibia, and we sit with the parliamentarians in the committee of community development, whereby we take issues from the community and take it to the parliamentarians who are the lawmakers of this country.
Piti fama ngongo je. O piti fama. Oya pita. Iya nana ne. Ondu tamake mo konga mo support kurupa. Omonenda tuma njikalo nguni mau. Haitame no kutunga. Sasbe fa durungo no kufana po njali ko ke support kurupa dikwa tuka taire pova kotu. Sha tukulango maile. Me varango ngale kulonga uni mawe ilongo pumbapa. Bone kupa.
Babali.
Beli bangapi?
Babali.
One kuno na babali. So sha kala ne siju o atelele ke nkwenga munuka filinga oponaye kupe opo filinga hapo. Befenga atu kwa fango atushi.
We work with women in the support groups, in the informal settlements. And this year we have extended our project to Okahanja. And we are now in 5 rand informal settlement.
In our support group, I get that information, how to make the beads, how to make a bags, a dish, flower pot.
Sarafina and Sylvia, they didn't know each other, but they met at the training. And now they have decided to do their business together to make a joint hand so that they can attend the expo.
So that by next week we go and make a business together at the expo. We women, we must come together and work together. They call me to go for the training. It's where I get power. I'm now having power. I can also encouraging my friends. I was not even tell my kids or my family that I'm HIV positive, but because I was scared. But right now, I decide to go and tell them.
Our aim is to provide information, education, and skills and capacity building to the women in the community, especially in the informal settlement. So today we are here to just let's discuss a little bit about gender-based violence. If we know what is gender-based violence.
Hey, woman.
Oh my God.
Huh?
What's happened?
What are you doing here?
My dear husband, you are drunk.
What are you doing here? You are useless to me. You can't do nothing. You can't even give me children. Get out! Take your child. Hey, go! Hey!
Yeah, gender violence is also a risk in our location. Even due to lack of electricity here, it's caused so much violence. Yeah, women are beaten up by their husbands. Because, you know, even alcohol is too much here. Bars are just open 24 hours and even they have been told to close them so they don't care. So we are in a big risk here. We are in a big risk. So we need maybe it to be solved.
Rafina explained about the inheritance grabbing, whereby when a husband or a partner just pass away, the family members, especially the sister-in-laws, are the one who want to come and take everything from the widow.
No meme. Otoya ponga hewa kushitondoka. Ashiko twautango kutya mwameme okwasa. Ndo tusisi kutya mkuluka joya aliapo mwameme. Ndo basho isho tunokuitengulula. Onkajo twe mudanale kutya halio van. Nasi hatwende momo mkuluka wetu. Oh, ndo kwesimana ndo basho itatwifie momo. Nongobe nga nongobe.
Solimeme topopi. Shobashinde shite hapa. Otubashinda banangula. Deme nanguli tanye kwa nando pashu ya kwa kala mutimbo. Shoke hapo pia kufira nangula. Nanguli takufini maene. Ay. Nanyoma hombo ba kumwaje. Nanye kwini maeni. Nanguli takufini mayai. Omala shike mwala kukufira nangula pashu ya kuna nunona. Nangula nakala mapashu omu. Nangula ombili katona kangwani shobashinda shopo tuli hapo pia kukuhekeleka. Ombili ka umewani.
We've got the same problems here, and sometimes going to the police is no solution will be reached at the end of the day. But for now that the people know their rights, I think things will be done accordingly.
By now, I'm quite free. I'm even healthy. I got married. I'm got a family. My husband have also joined the support group. Together we are very strong couples. I encourage to other women who have been in the same situation as I was. I would like just to encourage them to get up and join the support groups.